A fatty liver is a serious disease many people think is caused solely by drinking too much alcohol. But it is not just alcohol. In fact, 10 to 30% of all people suffer from the so-called non-alcoholic fatty liver disease. But what causes people to develop it? Dr. Max Nieuwdorp is a medical doctor treating patients with fatty liver disease.
So most people that achieve a fatty liver are a little bit overweight.
The main factors for getting a non-alcoholic fatty liver disease is an inactive lifestyle and an unhealthy diet, a condition that has consequences.
When there's too much of this fat in the liver, it will have some toxic effects on the liver cells itself. The liver is then producing a lot of fat. That is also why a fatty liver disease is related to more cardiovascular disease.
Intense training can help to treat this issue. In addition to this, there may be another factor that influences the development of a fatty liver. Our shit. Or, in more distinct words, the microbiome in our gut.
There's tremendous findings that microbes really drive the way we feel and our fatty liver disease and diabetes and cardiovascular disease.
The way the bacteria in our gut interact with our body is something that the Besttreat team wanted to know better.
So in this Besttreat, we're just looking for which bacteria play a role in fatty liver disease and are they influenced by exercise. And the next step, of course, is that we, as a clinician, we would like to see if you treat patients with these new bacteria or with the good shit, as you might call it, that you can then get the better effect of exercise. So you keep patients better motivated.
So obviously there are bad and good bacteria in our gut, and science may find the baddies. But how can a microbiome then be modified?
This usually we do via a tube, which we put in the nose and then in the intestine, in the gut. And there we just infuse this mixed healthy donor stool in the gut of these patients. We've done a lot of these fecal transplants by these tubes, and we're now starting studies where we give them capsules with shit.
So eating shit may be an option for treating a fatty liver once it appeared, but before that, there is another goal that Besttreat wants to achieve: knowing shit to the extent that it can be used as a predictor.
So it's a two-step approach. I think first is what we're going to do with these data is see if we can find markers in the shit that can help us in the clinic or outside in the general population to identify patients at risk of fatty liver disease. And next is to find new therapies. But that is a long way. That will take several years.